So hello everyone. I'm Mike Grandinetti, and it is my pleasure and my honor to present on behalf of the CoVent19 Challenge team. Can you imagine, just for a moment, not being able to breathe? What a terrifying that experience must be. And I'm sure for many of you who have asthma or bronchial issues, you know all too well the fear. Jim Bello, a Boston area native, a very fit and active 49-year-old father of three, contracted COVID-19 and spent 32 days on a ventilator in Mass General Hospital in downtown Boston. If he did not have a ventilator, a critical care ventilator, his family would have lost him. We have at least we are short at least 500,000 ventilators in this country for health crises such as these, according to Johns Hopkins. How did that happen? There's a lot to be discussed, but I'm going to just share two anecdotes. 6 years ago, Royal Philips, using U.S. taxpayer money, worked in partnership with the Biomedical Advanced Research Development Authority to create a new low-cost critical care ventilator. It resulted in a $14 million contract with the Department of Health and Human Services to deliver ventilators at $3,280 a unit. Not a single ventilator from that contract was ever delivered. Under duress, HHS then entered into a second contract where the price of the ventilator has increased by almost 5x. There was enough concern that the U.S. Congress has now formed a subcommittee to investigate exactly what happened. As a result of the national stockpile being depleted, there was a tremendous amount of fear and anxiety around access to ventilators at the time that this disease was peaking. In fact, the President of the United States, using Twitter, went out to admonish Ford, GM, and others to get going on ventilators, and one of the responses came from an unknown Silicon Valley engineer with only 70 Twitter followers who urged someone to call him. New York State called him and wired him $70 million. Not a single ventilator was delivered, and he is nowhere to be found. COVID-19 Challenge was formed to close this critical gap between the actual resources that we have today and those that are required around the world. Our very first initiative was to rely on an open call, an innovation tournament, where we asked teams from around the world to rapidly design ICU-class ventilators that could be produced economically and quickly. Exceeding our greatest expectations, we had well over 210 submissions from 43 countries, and we've now selected 7 finalists. The finalists represent a remarkable span of humankind, but the one thing that brings them all together is their desire to contribute during a time of great need, their innovation skills. We have a team of 8 Stanford University deans and professors of medicine, engineering, and applied physics, working with the CTO of NVIDIA and an engineer at Waymo as one team. Another team is comprised of a number of rocket scientists from NASA and SpaceX. A third team comes from Accenture and their ecosystem. Another is a lone inventor from Scotland who actually won a recent Queen's Innovation Award. These individuals have brought their talent, their creativity, and their intellect to solving this critical challenge. And our mission, the mission of Dr. Rich Boyer, the team leader, and 12 other anesthesiology residents at Mass General Hospital, combined with an advisory board that I'm proud to be a part of, and a significant number of extremely generous engineering and biomedical and financial resources aim to bring one of those designs to the world. What we believe in at CoVent19 is the power of humankind to innovate. And we've seen in just 30 days how true that is. How many people want to be able to help if you just give them the platform to do so. This has validated what we believe is going to be a much longer term journey. We want to address the entire critical medical device and medical equipment industry and reinvent it by leveraging innovation challenge methodologies and open source economics to create medically validated, affordable, open, royalty-free, easy-to-use, easily manufactured, and rapidly distributed medical equipment as an ICU as a service. And so, quoting one of the contributors, Dr. David Gaba, a legendary professor of medicine at Stanford University, if you can save one person, you can save the world. We are looking for $750,000 in funds to perform design testing, go through regulatory submissions with the FDA, cover operational expenses, and begin initial production. We are a nonprofit 5013C, and our only mission is to bring these medical devices to the world. Thank you.